Sir, wait, please. Yes.
Yeah.
Very good morning to all. Now we are in second session of AICT sponsored FDP on Nutrigenomics Unveiled Frontier in Healthcare, organized by Bharati Vidyapeeth College of Pharmacy, Kolhapur. Now I would like to request Ms. Yasin ma'am to introduce our guest speaker, Dr. Amol Raut sir. Over to you, ma'am.
Thank you very much, ma'am. Good afternoon, everyone. Myself, Yasmin Momi. I'm here to introduce our next speaker, Dr. Amol Rao Sirji. Sir has completed his PhD at Bhabha Atomic Research Center, Mumbai. Currently, he is working as CEO at Gene Support and Director of Gene Technology, Pune. His major research areas are molecular microbiology, molecular diagnostic assay development, and nutrigenomics. Sir has published 16 papers in national and international journals. He has been honored with Research Fellowship Awards at Department of Atomic Energy by the Government of India. He has also given the trainings to the at AIMS New Delhi, National Center for Cell Science, Pune. He had worked as R&D project leader at PRAS Industries, Pune and head Department of Biotechnology, RJSPM College of Pune. He also worked as a visiting faculty at Savitribai Phule Pune University, D.Y. Patil University, SNDT University, and Symbiosis International University. He is also the member of Board of Studies Microbiology, Savitribai Phule Pune University, and work as co-investigator for Ayush project. With this introduction, I would like to request Dr. Amol Rao sir, please proceed with your session, sir. Please, sir.
Okay. Can you hear me?
Yes, sir, you are audible.
Yes, sir.
Okay. So, a very good afternoon to all. First of all, Yasmin, madam, thank you very much for the kind words and wonderful introduction. At the onset, I would like to thank and congratulate the entire team of Bharati Vidyapeeth College of Pharmacy, specifically Honorable Principal More sir, Dr. Tambori sir, Dr. Thorat sir for organizing and other faculty members for organizing this wonderful FDP program. I am also grateful to Dr. Abhay Harsulkar. Sir had suggested that I should be talking on this program, so I'm thankful to him also for giving me this opportunity to talk. And of course, a very good afternoon and wonderful getting connected with all the delegates from different parts of the country and different institutions. So I'm going to start my discussion today on the subject nutrigenomics. May I have the request to present my screen? Is it possible that I can share the screen?
Yes, sir.
Sure. Can you see the screen? Can you see the presentation?
Yes, sir.
I hope the presentation is visible.
Yes, sir, it's visible.
Perfect. Okay. Thank you very much. So yes. So finally, now we are going to start our discussion in the about nutrigenomics and what is nutrigenomics. Of course, the entire program is on nutrigenomics. I'm sure that there have been many experts who have been deliberating on this topic or allied and relevant topics. Now, I'll quickly give you my background. The reason because I think that background is important in terms of sharing with you what thoughts I have about the science nutrigenomics and why probably I chose to describe this topic as a precision tool in lifestyle disease management. So first of all, as mentioned during the introduction session, I am heading an organization called as Gene Support and Genome Biotechnologies, which is based in Pune. It is a DSIR NABL recognized accredited genomic R&D lab that has been functioning in Pune since last more than 16 years now. And for last about 8 years, I'm glad to mention that we have been working in the field of nutrigenomics. that is not just doing research in nutrigenomics, but also developing certain genetic tests so that it could be used by people or it could be used by patients. So I'm here today to express and share with you not just the fundamentals of nutrigenomics, but what experiences we have had when it comes to offering nutrigenomics to people. What is nutrigenomics as a science, how it is perceived by people, and why would someone want to do nutrigenomics? Who will benefit from nutrigenomics? What are the results and so on? So this is the reason since last 8 years and having tested more than 18,000 people in the country, which according to my understanding or according to my knowledge is probably the highest that any nutrigenomic company or organization would have done in terms of testing in the country. So I'm happy to mention that I'm bringing this, I would say, experience in terms of what people have shared with you over here on the program, and I would want to definitely share it with you. So going ahead, let's start our discussion today in terms of what is nutrigenomics. Now, or rather, how does it start, and where do we start in terms of discussing nutrigenomics? Now, when we talk about nutrigenomics, the first and foremost thing is important to understand that nutrigenomics should be considered. I'll repeat, nutrigenomics should be considered as a diagnostic tool by the people such as dietitians or doctors or all those people who are involved in providing intervention or advice to the individual. So, like I'm sure that all of us have used when we visit doctors or when we consult diet experts and exercise experts, all these experts would use the tools such as a simple blood test or maybe asking us to do a body composition analysis, body fat, muscle percentages, and so on. So these data points or these are the tools used by the experts to understand what is our current health status, also understand what is our family history or past health concern, and based on all this data, be it a doctor, be it a dietitian, be it a exercise expert, they would use this information to suggest changes in our diet, drug, medicine, or exercise such that our health objective will be achieved. So, this is something that already currently people are doing. Now, where does genetics or where does nutrigenomics play a role? Let us consider nutrigenomics also as an additional diagnostic tool. So, let's say, for example, if I am suffering from type 2 diabetes, for example, and if I visit a doctor or if I consult a dietitian and I start asking them that what should I do about controlling my type 2 diabetes, obviously the doctor would give me suggestions on the medicines that I should consume. The dietitian will give me or the clinical nutritionist will give me advice on which food I should consume, which foods I should avoid, and so on. And a combination of this, when I start following, it helps me in controlling my diabetes. So if I now go to a doctor and dietitian who is already equipped with understanding about my body with the help of a nutrigenomic tool, and there are a few more points that the doctor or dietitian will come to know about myself, definitely it will prove to be a better tool with these experts so that they can handle my disease better. Just to give an example, we all over here know that what is the importance of exercise in obesity management. Now, when we talk about obesity management, we all know that exercise is important, and unfortunately, I'm probably not able to see. Sorry, I'm not able to see the. Yeah, I think I'm shift. The screen is shifting. Just a moment, please. Uh, there is some challenge with the screen sharing that I'm getting.
Yes, sir. It's visible, sir.
Yeah, it's visible, but it's also going off often. Yeah. So it's automatically going off. So I have to keep on sharing. So can someone help me why this is happening?
Sir, can you send your presentation to Tamburi, sir? We can present it from our side.
Okay, I can do that. Can do that. Could you please excuse me for a moment? I'll just do that right away.
Yes, sir, please.
Okay, ma'am. I've shared the presentation by email.
Yes, sir.
Sure. I'm afraid I don't know why I couldn't share that. So anyway, by the time Dr. Tamburi sir would share my presentation and he would get, I think I'll continue with the discussion that I had been doing. So,
Yes, sir, please.
okay, great. So I was talking about nutrigenomics, who should use, how it should be used. So let's say, for example, I'm glad that I'll probably be able to also see the chat box now, and I'm going to request the members to opine in the chat box or ask queries in the chat box also while we are discussing this. Okay, so let's say, for example, if a person who is suffering from obesity visits a doctor or a dietitian or an exercise expert and says that I would want to lose weight, but I would want to know the right time for exercise. So, what according to you, what according to the esteemed audience over here, do you feel is the right time for exercise? So, if someone has to lose weight, or let's say someone is working towards diabetes management, or someone is working towards cholesterol improvement, and so on. So, what according to you, and please write your answers in the chat box so that I hope it is enabled and we are able to see the chat box is responsive. So, what according to you is the right time for exercise? While the presentation is also on and while we are starting a discussion, if I could get those answers, please type your responses. Please suggest what according to you is the right time for exercise. You may give your opinion, you may give something that you have experienced, or uh, or something, maybe let's say for example, okay, you have read. Okay, wonderful. So we have the presentation done now. Ma'am, would we be able to get chats responses?
Take it, sir. Just a minute. Is the presentation visible to you?
Yes, it is visible.
चॅट बॉक्स चेक करा, क्वेश्चन आहेत काय बघा. ते PDF आहे प्रेझेंटेशनचं, त्याच्यामुळे तसं व्हायला लागले.
होऊ शकतो मॅडम, तुम्ही त्याला फुल स्क्रीन मोडवर टाकलं तर ते दिसेल आता सगळं.
येस सर, जस्ट मिनिट सर. There are no questions in the chat box, sir. Can we start the presentation?
Yeah, but okay. People can write in the chat box, right?
Yes, sir. Yes.
Okay. Okay, so my yeah. So the point that we were discussing over here is that when it comes to weight loss, what would be the right time for exercise? What is the right time? Now, while I was waiting, let's say for some of the results, okay, I'll quickly start. So there are often thoughts that people say that morning time, early morning time is a good time for exercise, or maybe evening time is a good time for exercise. Some would say that okay, time between 5 and 6 a.m. in the early morning is good. Some would say that no, maybe afternoon. I have been exercising in the afternoon. I found that is a better time, which means that when we start talking about exercise as a tool for lifestyle disease management, or as a tool for obesity management, or as a tool for weight loss, we all have our different opinion, we all have our different experiences, and when we visit dietitians, doctors, and we consult them, we also get different opinions from them. However, one of the important facts is that when it comes to weight loss, when it comes to exercise responsiveness and impact of exercise on weight loss, genetics will play a role. There is a set of genes in our body called as clock genes, CLOCK. Now, these are the genes that govern the body clock. Now, these genes, or one of such gene called as clock gene, can actually or is actually responsible in deciding whether exercise responsiveness of a person will be better in morning or it will be better in evening. Yes, which means that, let's say, for example, we have somewhere around 50, 60 people here in the audience. Some of us may have a clock gene of such a nature that for us, the right time for exercise is morning, while for some of us, the right time for exercise is evening. Now, let us say if amongst us we are trying to lose weight, and let's say, for example, if I'm trying to lose weight and I have an evening clock gene, but I'm not aware of it, what I would do is I will start, since I don't know that my body clock is toned towards evening, the exercise that I do should be better or it would give better response in the evening. If I'm not aware of this, what I would do is I would get up early in the morning. I would maybe go for jogging, running, walking, cycling, or maybe do a gym and start doing my exercise. Now, I do not know that my response time for exercise is better in the evening. Hence, it happens so that while I'm doing my exercises, there are few observations or few concerns that I start facing. One is the weight loss is not as fast as it could have been. Second is my energy levels are not that good in the morning when I'm trying to do exercise because my body clock is shifted towards evening. Third important thing is that in attempt to get up early in the morning, probably I'm sacrificing my sleep, and hence there is some degree of fatigue early in the morning, which is not giving me sufficient thrust or energy to carry out the exercise. So, which means that if a person is not aware of his genetic makeup, he may be simply working out or simply doing exercise at the wrong time, which means that, let's say, if I was supposed to lose 2% of body fat or 3% of body fat, or in terms of kg, if I would have, let's say, lost 2 kgs or 3 kgs by some exercise within a period of, let's say, 1 month or 30 days, in while doing it at the wrong time, because I didn't knew about it, I may lose less. Instead of 3 kgs, I might have lost just 1 kg or 1.5 kg and so on. So there are many people in the world who are not aware of what their genetic makeup is and how it is governing our body. And hence, there are many diseases such as diabetes, obesity, heart diseases, other cardiac diseases, PCOS, which are in the category of lifestyle diseases. These are the diseases where the diet, exercise, lifestyle control is very important. Since we do not know what is the right diet and exercise for us, we simply may be following the diet, exercise, or lifestyle which is not suitable for us. Hence, my dear audience, what do we mean by nutrigenomics? Nutrigenomics is a simple science that tells that what diet is good for you, what exercise is good for you, what lifestyle pattern is good for you, and what you should follow. Now, what would happen if a person doesn't follow it? Is it so that the person will suffer from severe challenges? Well, no. If a person is for some reason doesn't know his genetic makeup and is not following diet, exercise, lifestyle as per his genetic makeup, that doesn't mean that the person may land up in a severe problem altogether, but definitely the solutions that the person may be looking for some diseases is not definitely going to be available. Now, coming to the slide that we have over here, what are these lifestyle diseases? How do molecular biologists look at lifestyle diseases? How would dietitians and doctors look at lifestyle disease? So when I say lifestyle diseases, naturally these are the diseases which in majority cases people are not born with. I'll repeat. Lifestyle diseases are those cases which in majority of the cases people are not born with. They acquire these disease during their lifetime, and they acquire it not just because of the genetic risk that they are carrying, but they acquire these diseases or they start suffering from these diseases, especially because probably they've led not a very good lifestyle. Now, this lifestyle is nothing but the diet, exercise that we follow, and hence I'm calling it as the complete cascade or the complete paraphernalia of it is, I'm calling it as environment. So, if let's say I have a family history of diabetes, it is quite likely that I will suffer from diabetes. But what happens if I have just the genetic risk or a family history of diabetes, but I also start living a very bad lifestyle? I do not exercise, I do not follow a good amount of diet, I eat a lot of junk food, so I do not pay attention in anything at all to my diet and lifestyle, and I also have a family history, naturally the thought in your mind is that since my lifestyle is also not good, his family history is also not very nice because I have a family history of type 2 diabetes. By default, there are high chances that I'm going to suffer from type 2 diabetes. Okay. On the other hand, imagine a case. Just imagine a case. If I was not having any family history of type 2 diabetes, that all the people, my father, mother, and their parents, and the relatives, I do not know anyone in nearby relation who is suffering from type 2 diabetes. Besides, let's say, for example, I also follow very disciplined lifestyle. I eat the right food, I exercise, I do not have any addictions, I have proper sleep, get up at right time in the morning, and so on. And I am following my diet very well, lifestyle very well. Naturally, you would think that a person living this kind of lifestyle, also having no genetic risk, naturally he has least chances of type 2 diabetes. Now, obviously, there would be people who would be from apart from this extreme category of good genetic makeup, good lifestyle, or bad genetic makeup, bad lifestyle. There would be people who would fall in the category in between. But what is common in all this is one thing is to be understood, or one thing is clear, that only genetic makeup or only environment or the lifestyle doesn't cause disease. It's always the combination of it which cause diseases. And hence, Nutrigenomics relies on the fact that, please note, Nutrigenomics relies on the fact that you cannot change your genes, but you definitely can understand your genes and change your lifestyle accordingly. I gave an example, I'll repeat. You cannot change your genes or genetic makeup, but you definitely can change the environment or the lifestyle in which you are living. And if that change helps, definitely it will help in control. For example, if I'm born with, let's say, an evening clock gene, that my exercise responsiveness is better in the evening, that means that definitely I cannot change my genetic makeup from evening to morning. But since now I know that I'm an evening clock gene person, I can certainly change my lifestyle. I can change my exercise schedule from morning to evening because I now know that I'll be getting a better response to exercise when I start doing it in the evening. So, you know what? Next time when you see a person who is suffering from obesity and is struggling to lose weight, and the person claims, he or she claims, that she has been following all the right diet, the person has been following all the right exercises, but yet the person has not been able to lose weight. You know what it means? It means that probably the person is not following the diet and exercise as per what his or her body needs are. Maybe the person is not following it as per the genetic makeup. And this is what genes and environment. Let's move to the next slide, please. Now, while we have understood that, next slide, please. Yeah, while we have understood the genetic makeup plays a role, and in nutrigenomics is nothing but a tool to understand uh, the individual better and suggest him accordingly his diet and exercise. Now, in order to understand how genes or how genetic makeup is correlated with different lifestyle diseases or different condition, let's try and understand this diagram. Now, this diagram over here, as you can see, is a diagram of a tree, which I'm saying that it is like a human body. So just like a tree over here, you can see that there are branches and leaves and stems which we can actually see. What is underneath the ground, which we obviously cannot see by naked eyes, is nothing but the roots of the tree. So you see the stem leaves, you don't see the roots. But definitely what happens with the stem and leaves and branches is something that's governed by the roots of the plant. So, human body is also the same. When a person is suffering from lifestyle diseases such as obesity, diabetes, PCOS, hypertension, or even for that matter, fatigue, simple things such as fatigue, why a person, we see these symptoms, why a person is suffering from all these conditions or has a risk of this, the reason is the person is suffering is because there are some metabolic imbalances that are happening within the body which we cannot see by naked eyes through our, but definitely these are the reasons for the complication. For example, fatigue. Now, when I say fatigue, chronic fatigue, a person feels lethargic, has lack of energy, and so on. Normally, the thought that we have is maybe less sleep, less of energy intake through right amount of food, or maybe some of us would start concluding that the person doesn't have significant or right amount of hemoglobin and so on, seldom we consider that one of the reasons for chronic fatigue could be chronic inflammation. What is chronic inflammation? Inflammation is swelling that happens in the body, and this swelling happens in the body because of release of some chemicals such as TNF alpha, interleukin 6, and so on. So, dear audience, the reason why a person suffers from fatigue throughout is probably the person's body is producing a large amount of inflammatory molecules. One of the molecule we know, and that is CRP, where many doctors ask to check CRP. In COVID times, we have seen that CRP definitely attained center stage status, and CRP was being evaluated as an important parameter. So there may be people who are genetically programmed in such a way that they'll produce large amount of CRP in other inflammatory molecules, and that has resulted into fatigue. IBS, irritable bowel syndrome, or a lot of digestive disorders, they are also caused because of such inflammation. And maybe one of the other important factor for that could be the food, the wrong food that we are consuming. Now, there's a very interesting piece of information that I would want to share. That in our country like India, where we could have done food sensitivity testing for more than 7,500 people till date. We have tested more than 7,000 people for their sensitivity towards a food called as gluten. That is wheat. So gluten is a protein present in wheat. And when we checked their sensitivity, we found that more than 80% people are actually having sensitivity to gluten. You know what it means? That 80% of us probably are sensitive to gluten. Gluten or wheat is not the right food for us, and whenever we consume it, there is going to be some trigger in our body, which is some problem is causing. Okay, let me take an example. One of the common examples of gluten sensitivity is uh, chronic acidity. There are many people who suffer from acidity, prolonged acidity. Okay, there are many people who suffer from acne, pimples. There are many people who have been unfortunately suffering from irritable bowels. That is, they eat food and they have to pass stools very frequently. Science and results have shown that in large number of such cases, gluten has been the cause. So next time you come across an individual who says that, okay, I am suffering from a lot of digestive issues, health issues, can we do one thing? Can we ask that individual, can we advise that individual to stop consuming any form of wheat for a period of 1 week or 10 days? It's a very simple suggestion. What you can simply do is ask that individual, why don't you stop consuming wheat? So anything that is made up of wheat, maybe wheat, rava, maida, suji, okay, and bakery products, all these things which have wheat in some or the other form. If that person stops consuming that, and instead of that he consumes jowar, bajra, rice, corn, these are different foods do not have gluten in it. Starts consuming that. And if the person notices that there is a difference in the symptom, okay, we can definitely say that gluten was a trigger point in these individuals. So the basis for that person's health issue, one of the symptom was nothing but prolonged inflammation, food sensitivities, and this was something that was a result of that. Now, definitely such people after 10 days, they would say that, okay, now I'm feeling better. Since I've stopped gluten, consuming gluten, my acidity has reduced, maybe the bloating has reduced, flatulence has reduced, and so on, maybe some other health, digestive health issues. Then definitely the next question the person would ask is that by stopping gluten consumption, if this is happening, so obviously the person is sensitive to gluten. Would the person would then want to ask that is it so that I'm required to stop consuming wheat throughout my life? Because that's very difficult to do, and this is where dear team members, it is important to understand genetic makeup, because once in such individual we have identified that stopping gluten helps, it is important now to check whether that person is genetically sensitive to gluten. If the person carries genetic sensitivity of gluten, which is gluten's intolerance, then the right advice coming from the dietitians or nutritionists on how to avoid gluten, how to eliminate gluten. Is complete elimination of gluten required, or partially wheat can be consumed? So in which condition, what condition? These type of advices can be taken. So the question, so the to answer the question, what is nutrigenomics and where it can be used? There are people who suffer from many lifestyle diseases. There are various reasons why people suffer from lifestyle diseases, their genetic makeup as well as their current diet and so on. There are many challenges that people have in terms of lifestyle diseases. Genetics, the study of nutrigenomics, can help in giving answers to some of the problems. Okay, one of the other symptom that has been observed is in case of women, in case of young girls or maybe in women, there is something called as perimenopausal condition. That is, women suffer from a terrible pain just at the beginning of the menstrual cycle, maybe in the initial 3 4 days. Some women do suffer from that. It has been identified that gluten is one of the trigger for such pain, which means that in the initial periods of in the initial days of the menstrual cycle, that is the first, second, third day, when the pain is at the highest peak, if gluten is avoided, I'll repeat, if gluten is avoided, the inflammatory molecules, the inflammatory reactions are lowered down, and hence the person can see some relief. The lady can see some relief in terms of pain. Okay, so which also can suggest that whether the person is sensitive to gluten or not. So let us consider nutrigenomics as a science to understand whether we can give solutions to people for their lifestyle diseases. This is what we can do. So let's move to the next slide where we'll try to understand what is nutrigenomics and what is the position in. So now that we know that in case of human beings, lifestyle disease is nothing but a combination of the genetic makeup that we are born with and the diet or lifestyle that we live. So, genes are not modifiable, but definitely what we can do is we can change our diet, exercise, lifestyle pattern. We can change our exercise time, we can change our diet, we can do some inclusions in the diet, we can do some exclusion. And based on the genetic makeup, when we start doing it, there is a solution that is possible to lifestyle disease. Now, my dear audience, the problem in our country, unfortunately, is that I have come across in last more than 20 years of my experience in the field of genomics and molecular biology. In last more than 8 years, when we have been using nutrigenomic tool to reach people in the country, what we have experienced is, unfortunately, there are some organizations, some companies who have been doing nutrigenomic testing and taking it aggressively to people. They've positioned nutrigenomic as a tool to predict diseases. I will repeat. There are some organizations who have positioned nutrigenomic test as a test to predict diseases in people. Whether a person will suffer from diabetes, whether a person will suffer from heart diseases, whether a person will suffer from some XYZ diseases. This is the type of communication that is shared with people. Now, what happens is the moment you start sharing this type of communication to a common man who doesn't know about genetics, who doesn't know about nutrigenomics, they start becoming curious and they'll start expecting a lot from the genetic test. Well, the fact is, let me tell you the fact. In our country today, except few cardiovascular complications, I'll repeat, in our country today, except few cardiovascular complications, genetic tests are not able to predict lifestyle diseases. We do not have sufficient or enough data to predict lifestyle diseases. Nutrigenomic tests definitely can be used to make changes in the diet such that the disease management is better or overall disease risk is reduced. But it will be wrong, it will be incomplete to predict those. There are many research groups, and I'm sure that you would also come across many such scientists and experts, maybe during this session or later on, who mention that what is the type of research that is being done. But as we go ahead, a larger amount of research is required to understand and without fail, very sharply and pinpointedly say that, okay, we now have a genetic test and it's an absolute predictor of a particular lifestyle diseases. So there are some cardiovascular diseases, there are some other metabolic condition where to a fair degree prediction is possible, but a very broad prediction is not possible. So let's not expect that from nutrigenomics. So on the next slide, when we try to understand the position of nutrigenomics, next slide please. So nutrigenomics is nothing. Okay, can we have the next slide please? Thank you. Okay, so nutrigenomics should be looked as a science where it can be used to strike the right balance between clinical management and lifestyle management. That is the diet, exercise, and lifestyle management. Nutrigenomics can be used, or the science of genetics basically can be used to handle both. So it can be a good tool at the hands of a dietitian to decide what is the right diet, exercise, lifestyle. At the same time, I'm going to talk briefly on that part at the end of my session. Is it can also be used as a tool for doctors or tool by doctors to understand that which medicine is right. Yes. So FDA is listed somewhere around 150 plus medicines, and I think I'm talking to the right audience over here. You all come from the at least most of you come from the pharmacology background and pharmaceutical background. US FDA has listed more than 150 drugs, which according to US FDA, once you do a genetic test, you'll be able to identify whether a person will show response to that drug or not, right? And so on. So both clinical as well as diet and lifestyle management is possible by understanding genetic makeup. Next slide, please. Now, while we have understood the position, let us start basically quickly getting into what is the definition of nutrigenomics, the conventional definition of nutrigenomics, and how it should be looked upon. What is the type of application that sorry, yeah. What is the type of application that people can have to it? So, nutrigenomics as a science can be defined as study of genes and effect of food on genes. I'm going to also come to the term nutrigenetics later on. So, nutrigenomics is science of study of genes and effect of food on genes. So, yes, there are foods that trigger some genes on and off. Triggering on and off, by that I would want to mention that there are many, not just food, but there are many factors around us that can actually trigger some genes on and off. Now, what do I mean by triggering gene on and off? Basically, a gene in the body, the function of a gene in the body is to produce certain protein. And there is a signal that is required by the body to produce that protein. Now, our environment, the food that we eat, the exercise that we follow, the sleep pattern that we have, the stress that we come across, all these factors together, they tell our genes whether they should be switched on or off. That means they should produce their relevant protein or not. For example, if my body is producing a protein called as CRP, C-reactive protein, which is responsible for causing inflammation. Now, if I get exposed to certain stress or certain factors, the cells in my body start receiving that stress signal and they will start producing more C-reactive protein. So that means the gene at that point has been more functional, it has become more active, it has been switched on for its regulation. Now, similarly, if the stress factors are reduced or removed, naturally it is also quite possible that such genes will be, I won't say switched off, but their activity will be reduced and the corresponding protein will be produced in less amount. So, not just food, but diet, exercise, lifestyle, and many other such parameters can trigger genes on and off. Gluten sensitivity was one of the example. Inflammation is one of it, and so on. And we are going to discuss a couple of them in next slide as well. So, understanding how food triggers gene on and off, and understanding which food you should consume as per your body requirement. These are the two aspects of nutrigenomics. Next slide, please. Now, since we have talked about nutrigenomics, let's try and understand where this science comes from. Well, the science is, in terms of application, is new, but the fundamental science that's behind nutrigenomics, that is genomics, is not new. Scientists across the world have been studying human DNA, human genetic makeup. Scientists across the world have also been studying how human DNA is correlated with the diseases that a person is suffering from. Then there are dietitians and doctors and health experts who have also been studying that is there an impact of genetic makeup on diet and so on. So likewise, there is umpteen research available today in the world which connects the dots between genetic makeup, diet, health, and so on. The challenge is, like in case of medicine, the challenge is that like in case of medicine, you have clear-cut evidence that, okay, this is a molecule. Let's say, for example, we know that paracetamol is a molecule. It has its analgesic activity or it has its antipyretic activity and so on. Similarly, let's say we talk about other antivirals. We are talking about abacavir. We are talking about certain statins. We know that how these molecules are going to act in the metabolism. So likewise, there are certain fixed guidelines for drug and drug use. But similarly, the connecting dots between genetics, diseases, and the diet, though they are pretty much studied, unfortunately, there is no guideline that has been prepared so far. So like we have pharmacopoeias, we do not have guidelines for nutrigenomics and so far. Pharmacogenomics is a field where genetic makeup is used to understand which drug is better. Fortunately, there are guidelines that have been developed on that. For nutrigenomics, the guidelines are yet to come. And hence, there is still some amount of standardization that is still required in the field of nutrigenomics. Next slide, please. But definitely, we certainly can understand and be sure that yes, the science is evolving and the science is good, and if positioned rightly, it can be used in a better way. Now, coming to the next part, who should undergo nutrigenomic test? Who should actually be testing nutrition? Very interesting question. As a person who is representing, let's say, a private organization, a company, which works absolutely on profit and the revenue generation basis, definitely as such an organization, I should say that everyone should be doing a nutrigenomic test because it helps. But let me tell you, as a person who has been involved in understanding experience of people in terms of nutrigenomic test will be appreciated. Nutrigenomic test or approach will be appreciated, will be picked up more by people who are resistant or stubborn cases. Yes, I'll repeat. Nutrigenomics will be picked up by resistant or stubborn cases. Now, what do I mean by stubborn? A stubborn person? I'm not referring to a stubborn person. What I'm trying to tell is nutrigenomics will be picked up by people who are resistant cases of a particular disease. A person suffering from obesity has tried multiple weight loss options but has not been successful. For such people, it will be worth looking into the genetic makeup. Those people who have been trying to have control on their cholesterol level and not been successful, for such people, nutrigenomic approach will be good. Why? Because it is this genetic analysis which will tell us why he has not been able to lose weight. Is it that the person was exercising at wrong time? Is it so that the gluten consumption in his diet was causing inflammation and hence reducing ability to lose weight? So there are n number of questions that could be answered. Hence, my dear audience, who is the right person to take up nutrigenomic case? The moment you see a person who is resistant or stubborn case, non-responder, these people will be more encouraged to take up nutrigenomic. That doesn't mean that others will not benefit. Others will benefit, but these would be the people who will be more benefited, and they'll see that data more, and they'll have more reason to undergo the test. Next slide, please. So, who needs nutrigenomic? Everyone will benefit, but definitely those who are resistant will appreciate it more. Now, in the process of typical disease management, where it includes therapy, understanding the disease and its progression, suggesting certain procedures, and also suggesting diet, exercise, lifestyle, let me tell you that today genetics has its position everywhere. Genetics or science of genomics can be used to understand which drug or which medicine will be better. Metformin, for that matter, 30% of population doesn't respond to metformin because they're genetically not tuned to metformin, and yet people, you'll go out there and see that people suffering from diabetes are consuming metformin. Why? Because a genetic test to understand whether metformin will work or not is more expensive as compared to a 6 months dose of metformin. So a person will come to know whether metformin is useful or not, or doctor will come to know whether metformin is working or not by practicing it or consuming it for 6 months or period of 2-3 months, and see whether really glycemic control is there or not, instead of doing a genetic test, because the test is expensive. So there are many reasons why the genetic tests for drugs are not used, but yes, it can be used. Second, genetic tests can also be used for predicting certain diseases. Which diseases, how, which condition is something we'll study in detail further. And nutrigenomic or genomic approach can also be used in suggesting diet, exercise, lifestyle. Unfortunately, till date, we haven't been able to conclude on how use of genomics in suggesting procedures. For example, surgeries, bariatric surgery, whether a person will respond to bariatric surgery for weight loss. Yes, there are people who have successfully been able to control their weight after the surgery, but there also have been people who have not been so much benefited, because even after doing the surgery, there was a weight regain that was seen. So genetics plays a role over there, MC4R, and likewise there are genes and whose mutations have also been seen, but yet it has not come in form of practice. Next slide, please. So far we have understood that nutrigenomics can definitely help. Which all conditions typically the world has seen that nutrigenomics is useful in managing? Can we manage a sickle cell anemia with nutrigenomics? Can we manage a Turner syndrome or Down syndrome with nutrigenomics? The answer, unfortunately, is no. Why? Because these are diseases that come under the category of inborn genetic errors. I'm talking about Down syndrome, Turner syndrome, sickle cell anemia. So all these are the conditions or diseases that are driven by genetics, but they are inborn genetic error. They cannot be reversed with the help of genetic testing or nutrigenomics. But there are lifestyle diseases where diet, exercise, lifestyle plays a role, such as obesity, diabetes, cardiac health, food intolerances, PCOS. These are the diseases where control of the disease can definitely be brought with the help of nutrigenomics. So, next time when you have to identify where nutrigenomics can be useful, it's useful in lifestyle diseases. It's useful in suggesting changes in diet, exercise, lifestyle. It is useful for limited number of diseases or metabolic condition. It doesn't apply to all lifestyle diseases. And at the same time, only doing a test is not useful. The test should be used as a guide by the doctor or dietitian to bring active changes in the diet, and then the control on the disease is possible. So this is how nutrigenomic will be useful. Next slide, please. Now, let's take example obesity. Now we all know that obesity is a challenge in country, and there have been many people who have been suffering from obesity. Now, obviously, when we talk about obesity, one of the major reasons for obesity in India is also our diet culture. Our diet culture is that we eat a lot of carbohydrate, we eat a lot of fats. So if you see a typical thali or a plate, it will have chapati, it will have rice, and then it will have one katori dal, one katori sabzi. So we eat three chapatis with sabzi. We eat this much of rice with dal. So the amount of carb intake or fat intake is much higher than the fiber and protein intake, and that's what is one of the major cause. The other important cause is that our genetic makeup. We have analyzed some genes. We have tested some genes. One of the example is PPR gamma. So PPAR gamma is a gene that is known to be connected with central obesity. Let me tell you, the audience over here, that we would have tested, let's say, the PPR gamma for mutation and its correlation with obesity in not less than 3,000 and odd people, and we have found that 98% people have the mutation that tells that this person will suffer from central obesity. So large number of population in India has that mutation towards central obesity. So no wonder that we suffer from central obesity. Okay. So a couple of common myths in terms of obesity, that our diet is healthy. No, it's not that. Our diet is not healthy every time. We eat a lot of carbohydrate and fats, and hence our diet is heavily towards obesogenic diet. Plus, we do not have correct information about following. So when I say we, I'm talking about India as a country, and we the people of India. So these are the challenges that we have. Now, next slide. What are the common approaches that people take for weight management, and where genetic take comes into picture? Next slide, please. So what are the common approaches? The common approaches, as you can see over here, the common approach is in terms of obesity, as you can see beneath the scale that I've shown, that if someone wants to lose weight, what are the methods that people do? People start following intermittent fasting. This became very popular a couple of years back. Intermittent fasting: eat only twice a day, eat only two times a day, do not eat anything in between, keep 8 hours gap, eat for 55 minutes. Okay, and then suddenly a lot of people started following that approach. मैं अभी दिन में 2 ही बार खाऊंगा, एक टाइम में 55 मिनट्स तक मैं खा सकता हूँ, कुछ भी खा सकता हूँ, कितना भी खा सकता हूँ, and then after for 8 hours I'm not going to eat anything, and suddenly after 8 hours I'm going to eat again a lot of things. This is called as intermittent fasting. Many people could lose weight because of that. Many people couldn't. Okay, many people couldn't. Now that was unfortunately a problem. Besides, it was not sustainable. Then there were many people who said that, oh, there were many dietitians who said नहीं ऐसा नहीं करना चाहिए, सिर्फ 2 बार खा के इतना सारा खाना is wrong. So instead of eating 2 times, you split your meals in multiple times a day. थोड़ा breakfast, थोड़ा lunch, थोड़ा mid afternoon, थोड़ा evening, dinner, post dinner, and so they split the meals into multiple parts. थोड़ा थोड़ा. So some people followed that pattern and they also lost weight. And there was a group who, in spite of following that, couldn't lose weight. So what does that mean? Whether you follow intermittent fasting or whether you follow multiple meals, whether you follow keto diet or a crash diet, there are people who will come up and say, this diet has worked in me or this diet has not worked in me. We do not have one diet pattern that will work for all of us. What does that mean, audience? it means that we are different. Our genetic makeup is different. Hence, whether a particular diet pattern will suit me or not has already been decided for me, maybe by my genes. And that's where genetic makeup comes into picture. This is where we are talking about application of nutrigenomics. So how is nutrigenomics helpful to a dietitian who's solving obesity problem of a person? The moment she comes across a person suffering from obesity and she wants to now give a suggestion and she comes across a genetic report of a nutrigenomic report, what she'll do is, or what he or the dietitian will do is, the dietitian will try and find out what is the right carb and fat balance. Our diet should have carbohydrate and fat and protein balance. That balance PCF ratio can be decided. Whether which meal pattern is better, two meal pattern or multiple meal pattern. Which exercise is better? Whether a person should be doing yoga or walking, jogging or gym. This is also something that can be find out. Then what is the right time for exercise, morning or evening? Okay, followed by that, if a person has a snacking tendency, eating every now and then, which is governed by genes such as MC4R, how to control that? Inflammation, there are foods that cause inflammation. There are so many factors that once a dietitian comes to know what is the genetic nature of that individual, he or she, that dietitian, can change the diet and exercise pattern in such a way that it suits that person. It actually adjusts to that person, and that's how the person will come to know that for me this is the pattern that I should follow. So nutrigenomics should be looked as a tool, as a guide for the doctor, for the dietitian, to suggest solutions to a problem, not just to predict them. Next slide please. Now, in order to understand this better, I thought that I should quickly pick up an example, a case. For example, over here, there was a person who came to us, a lady. There was a case, around 36 years of age. She was a female, height of 157 centimeter, at a weight of 76 kgs. Now, this lady was suffering from acidity. Obviously, 76 kgs weight, she was overweight. She was also suffering from acidity, other gastric distress, bloating, body pain. She had a lot of put on weight after, especially after pregnancy. Now, in terms of her lifestyle background, she was vegetarian. She had a habit of eating fried foods every now and then, okay, and so on. And otherwise, no other medical history apart from this. She was on calcium supplementation. Now, for her, the tests that she should have undergone, the genes that she should have checked, are weight management related genes or fat management. Now, currently, when she, before the nutrigenomic testing, she was put on calorie restriction. So, some other dietitian, some other doctor had suggested that, okay, you reduce your food intake, you do some form of exercise, and then iron and B12 was suggested because the lady was suffering from body pain and fatigue and so on. Now, next slide, please. For with this type of case, next slide. Once, let's say, a person undergoes a nutrigenomic analysis, what is the type of analysis that a nutrigenomic test will give? So, I'm going to draw the attention of the audience to this part of a table, which is a summary of the nutrigenomic analysis. As you can see that there is a list of genes over here in the second column called as gene name. So, gene name is the column where you can see different genes, ApoE, TNFA, PPARG. So these are the names of the different gene. Those who are new to genomics, pardon me, but this may sound Latin and Greek to you. But yes, these are the different names of the genes. Now, once the person undergoes this genetic testing, each gene has a correlation with some or the other health aspect. ApoE, as you can see on the left hand side, is correlated with vascular health. The second gene, TNF alpha, has its connection with inflammation. Similarly, I would request you to draw your attention to the last, second last or the last two genes, clock and PLIN. I'll repeat, I'll draw your attention to the last two genes, clock and PLN. So clock gene on the left hand side, you can see circadian rhythm. Clock gene refers to gene that tells you whether morning or evening time is better for exercise. So likewise, a lot of genes were studied in this person, lady, and based on what was the mutation or profile that was observed, on the right hand side, you can see that there is a traffic signal pattern. You can see that there are certain red dots, yellow dots, and green dots, and so on. So red, yellow, green means that what was the type of genetic information that was found in that person, and whether it is beneficial or not, and what action should be taken. So this is the type of analysis that is seen. Now, what is the correlation? First of all, in this person, the second last gene, let's say clock gene, we start with the second last gene, clock gene. This person had a clock gene such that exercise, both morning and evening time was good. So exercise time was not a challenge. So whether she is exercising morning, evening, it doesn't matter. Okay. But then I will draw your attention to the first gene, that is ApoE, first in the table, first in the list, first row, ApoE. Now this person carried a genotype E3, E4. The result was E3, E4, and you can see that there is a red dot. Red dot means that the person had a genetic or this ApoE gene in such a format that it was definitely causing a problem in weight loss. People with the result that E3, E4 that has been mentioned over here, and I'll let you know in subsequent slides that what this E3, E4 means. But people who have this type of genotype, E3, E4, okay, these people have a very high tendency of cholesterol or dyslipidemia. That means that the tendency of having low HDL, high LDL is very high. These people are also known to show very high amount of inflammatory signs and symptoms. That means body pain, etc., will always be there as a symptom. Second thing is it is very difficult for such people to control their cholesterol levels, and hence obesity control is also a challenge. Then followed by that, if you could see that there is a gene called as MC4R. So it is the fourth last gene that is from bottom. If you see, it is plin from bottom. I will repeat. You will see the gene is PLIN, plin, clock, EDRB3, and above that it is MC4R. MC4R, melanocortin 4 receptor gene. This gene controls the snacking tendency of the individual, which means that whether a person feels uh, whether a person feels whether he or she should eat every now and then is governed by this gene. That this person had a genetic makeup where snacking tendency was not there as per genotype. But if you remember the history said that the person said that he feels like eating every now and then. Now, how do you correlate that? It means that the person had a psychology of feeling eating every now and then. The person's genetic makeup doesn't drive that person to a metabolism, but the person requires energy every now and then. Okay, the person can very well remain starving for some time. Now, this is the type of person who can actually have the 2 meal pattern diet or the intermittent fasting diet, which means that eating only twice a day is good for such person, can be followed. But had this gene be red in color, the nutrigenomic expert would have suggested that no way, your genetic makeup doesn't allow you to stay fasting for a longer time. Your body will crave food for every now and then, so you cannot stay on a intermittent fasting diet for a longer time. You should split your meals into multiple parts. So, likewise, there are many other genes. So, what is that I'm trying to make a point over here? The point that I'm trying to make over here is with this 14 different genes that are listed over here, each gene, and I'm going to request to go to the next slide now. Each gene has a important information that can be shared with the individual. So the same case now on the left hand side, when you saw that the conventional diet advice was given based on nutrigenomics, what was suggested? The first thing was that if you remember, I had mentioned ApoE gene was red in color. So the first thing is that a lot of antioxidant, anti-inflammatory nutrient support is required because this person has a tendency of high inflammation. Okay, and when there is a tendency of high inflammation, this production of a lot of CRP, TNF alpha, IL-6, it happens so that the body is always in inflamed status. Body pain, weakness is persistent. Now, such individual, just note, such individual starts doing very high intensity exercise. It puts a lot of stress again on me. Any living organism in the stress condition will not lose its stored food. It will always keep the stored food with him or her. The same happens with human body. If the body is stressed and you try to do a lot of exercise, the body fat will remain as it is. It will not mobilize because body understands that it's a stress condition. So in such case, such people who have genetically a lot of inflammatory tendency, who are also now looking for weight loss and doing high intensity of exercise, You won't believe, but for weight loss, the advice is avoid high intensity exercise. Reduce the intensity of exercise. This is what people actually get surprised to when we tell them. They start asking, oh, acha, so after doing a genetic test, you're asking me to reduce my exercise in order to lose weight. That's surprising. People ask to increase, there are gym experts who will ask me to increase my exercise time or duration or to lose weight, and you are on the contrary asking me to reduce it. The answer is yes, we are asking you to reduce it because it is inflammation that's not letting your fat move. Definitely in such case, it is advised to reduce the intensity of exercise, consume a lot of antioxidant, anti-inflammatory, vitamin E's, another antioxidant, naturally occurring antioxidant through food. Okay, balance the right carbohydrate fat. The lady had snacking tendency, but not genetic. So just to satiate her or just to give her psychological support, it was suggested that she should have some healthy snacking options. So maybe it could be salads, it could be some other things that will not cause a problem. Okay, in terms of calorie. So this was the change was made based on genetic tests, and obviously the case the person was not able to lose was a stubborn case. He started responding to weight loss. Now, as long as she follows this, she will be definitely able to lose and maintain her. The bottom line is, let us understand nutrigenomics as a tool to fine tune the diet pattern of an individual or exercise pattern of an individual, lifestyle pattern of an individual. This is how it will help in achieving success. Right? Next slide, please. Can we go to the next slide? Okay, thank you. So, nutrigenomics, of course, like it is useful in obesity, it's also useful in heart health management. Yeah. So, there are, like in obesity, we discuss areas such as diet, exercise. Similarly, in cardiovascular diseases, there are parameters such as homocysteine. So, how is nutrigenomics useful in heart health? Is it useful in telling whether a person will, which day a person will have heart attack? Well, no, let's not do that. That cannot be done. That should not be done. We are not here to scare people. We are here to help people understand them how to use genetic tests to make their life better. So, genetic tests can tell what are the metabolic parameters based on their genetic makeup, whether there is a tendency of that parameter to go wrong or haywire, how to control them with the right diet, etc. So, as you can see in the column of genes govern on the left hand side bottom corner, genetic makeup of an individual governs tendency of homocysteine levels. It governs whether cholesterol levels will be good or bad or high or low, how to manage them. Many vascular diseases, that is hardening of the blood, arteries, vessels, etc., happens because there is a lot of oxidative stress. For those who come from the background of pharmaceutics and pharmacology, I need not tell you what is free radicals. I need not tell you what are oxidative stress and reactive oxygen species. You all know it very well. These ROS free radicals are generated in the body due to various stress and metabolic activities, and they need to be neutralized also. It is our diet that does that. And if the diet and nutrients in our body do not do that properly, then definitely it starts damaging the blood vessels. And hence, people suffer from oxidative stress related vascular damage. Some people are genetically more prone to it, some people are not prone to it. And that's how it is. Now, there's a gene called as ApoE, which is typically present in three different types, as you can see in this table: ApoE2, E3, E4. Okay, so in nutrigenomic, how this is an example to understand how cholesterol management works. So one gene ApoE2, E3, E4, after genetic test is done, we understand whether the person belongs to E2 category, E3 category, E4. Now, based on the category on the left hand side, you can see that below genotype, it is written population frequency, fish oil as an intervention, low fat diet as a solution, moderate alcohol consumption. So there are different parameters, and how people, when they are exposed to these different parameters, how with different E2, E3, E4 gene, they would respond. So for example, I'll just ask the audience, request the audience over here to pick up any any category. Consider whether you are E2 or E3 or E4. Pick up any column, E2, upper E2, E3, E4 column, and just try to see impact of moderate alcohol on your body. Okay, so if you start consuming moderate alcohol, let's say red wine, 1 glass a day, okay, red wine 1 glass a day, what happens to your cholesterol level? So if you're E2 category and you're consuming red wine 1 glass a day, okay, moderate alcohol consumption a day. Yeah, this people with E2 category gene, if you are born with E2 category, it can help you in improving your HDL. HDL is good cholesterol. So good, it increases. It can help you in lowering LDL. That's a bad cholesterol. So good, it can help you in reducing LDL. But let's say if you're born with E4 gene, ApoE4 response, same moderate alcohol, same red wine, what will be the impact? Studies have revealed that moderate alcohol consumption for people with E4 genotype may result into lowering of HDL. It may result into lowering of HDL. That means good cholesterol may come down, LDL may increase, bad cholesterol may go up. So it's exactly opposite to that of E2. So I'm sure that those who love red wine definitely would be praying that they are born with E2 category and not E4 category, because E4 gene definitely is going to put you a restriction on you in terms of how much red wine to be consumed. Red wine has its own benefit. It has several antioxidants in it, but it cannot be a blanket statement that it's good for everyone. So this is how genetic makeup helps in understanding how interventions can be done. Next slide, please. So this was about cardiac health and cholesterol. Next slide, please. Cholesterol health can be managed. Can I request the next slide, please? Are you able to hear me?
Yes, sir. You are audible to us.
Yes, ma'am. Please change the slide. Next slide. Okay, yeah. So, no, I think we have gone way ahead. So, can we go to the slide number 21, please?
21. Yes, it's 21.
Can we go to the slide number 21, please? Achha, okay, we are there.
Yes.
Thank you. Got it. So yeah, let's quickly go through the next couple of minutes, go through the fundamentals of nutrigenomics and gene expression, how this is done, what is the impact, and so on. Because I think I'm closing to the time that I should be concluding. I obviously may not be able to discuss all the slides. So the fundamentals is that yes, how nutrigenomics works. There might have been other sessions, but I'll quickly take you through that. So human body is made up of different cells, and all cells respond to nature and environment. But in each cell, what is the common thing? As we know that in each human body cell, there is nothing but the this group of chromosomes. There are 46 chromosomes in each cell. If you open up the chromosome is nothing but it is made of long thread of DNA. So on the DNA, there are different parts. Each part is called as a gene. So the 46 chromosomes are that we carry in our every cell is nothing but a long thread of DNA all put together. And that DNA is divided into different parts. Each part is called as a gene. And that gene, it carries information for making certain proteins. As you can see that ATGC, this is the type of information. And these proteins are those that play some or the other role, either a catalytic role or a structural role. So if the gene is, let's say, making a protein like lactase, or it's a gene that codes for certain enzyme, then it will produce a protein that will have an enzymatic reaction. If the protein, let's say, gene is for ostine, or maybe protein like ostine or chondrin, which are nothing but the bone or cartilage protein, it will produce proteins that are useful in making the bones and cartilage and so on. So every gene results in formation of a protein, and that protein has some or the other role in the body. Now, what does nutrigenomics do? Is in nutrigenomics, we focus on understanding whether a person carries the normal or otherwise considered to be common genetic information, or there is a variation. So some people have a slightly altered genetic makeup. You can assume that, let's say I have a normal recipe, you have a recipe book. So chromosome is like a recipe book. There are different pages. Each page is a gene, and every gene is carrying one recipe. And if there is a minor variation in that recipe, naturally the protein that is formed is different. So just imagine that let's say if I'm sharing with you a recipe of biryani and you are required to make biryani and you start following the recipe, you make wonderful biryani. But there's a mistake in that recipe. Instead of in the ingredient section, instead of rice, I put wheat over there. So what the person who doesn't know about biryani and starts following only the recipe, he'll make biryani from not rice but wheat. What an awful biryani it would be. Something that would be biryani made up of wheat and not rice. But yes, that's what we call as variation. So such type of variation or changes that are not common may result into an altered protein, a different protein. Now, fortunately, in genetics, it has been understood that some variations are good, whereas some variations are bad. That means some people are born with genetic variations and they make their metabolism weak, but there are some people who are born with variations and it actually imparts some strength in their body. So it gives a strength. One such example is in a gene called as LPL, lipoprotein lipase. So if you're born with a lipoprotein lipase normal gene, you'll have some levels of tendency of having LDL levels to a certain extent. But if there is a mutation, in that gene and you're born with the LPL mutation, it gives you a tendency of having low LDL. So you're genetically blessed to have low LDL, low bad cholesterol. So that's a good thing to be. So this is how it becomes easy for some people to control their cholesterol levels much better. So next slide, please. So this is how genes control different types of protein and their impact. And in nutrigenomics, next slide, please. What we study is we obviously know the central dogma that DNA codes for RNA and RNA codes for protein and so on. And then the proteins are responsible for different activities. For example, there is a gene called for inflammation. It codes for inflammatory molecules, and then that inflammatory molecules are responsible for causing inflammation. So let's go to the next slide to understand that. So far, we have understood that the gene codes for protein and the protein does different function. Now, some people, let's say, for example, let us take example of inflammation, TNF alpha or IL-6. So we all may carry a gene for, we all would carry a gene for IL-6, TNF alpha, and so on, which causes inflammation. Now, when we come across stress, when we all come across stress, some of us would produce high inflammatory molecules and some of us could produce less. This understanding of tendency is very important for doctors, dietitians, and exercise experts. Because if they understand that amongst, let's say, you and me, if I have a very high tendency of inflammation and you do not have, the dietitian or the exercise doctor will tell me that, okay, Amol, you cannot do high intensity exercise because you have a very high tendency of inflammation. To you, they'll say that, okay, you can do high intensity exercise depending upon your physical ability because you have a normal or routine inflammatory tendency. To me, they'll say that since you have very high inflammation tendency, you should start consuming anti-inflammatory food, be it curcumin, be it any other antioxidants and so on, which will or vitamin E, which will reduce my inflammation. So this is how genetics governs that inflammation, and this is how the information is useful to the doctors and dietitian. Next slide, please. So obviously, I think I've discussed this, that inflammation will have its impact on different parts of the body. Next slide. Now, I think I've given an example that a person carrying mutation in one of the gene, that is inflammation. What happens if the person is carrying? This information results in, or variation in the gene results either in formation of large number of inflammatory molecules. And next slide, please. These large inflammatory molecules will start then producing large inflammatory molecules. So how do we summarize this? The summarization is that if you consider that every gene, now this is, I've tried to put it in a very simple term, though this is not the exact technical information, but let's say every gene or one gene codes for one protein and that has one function in the human body. Okay, every gene codes for a protein and it has some or the other function in human body. Now, if that gene has some mutation in it, okay, if that gene has certain mutation in it, naturally the protein that is produced will be of altered type. Okay, it will be of altered type, and then definitely the altered protein will have an altered function. So let's say if I'm carrying producing inflammatory molecule, it will have altered protein molecule that is responsible for producing very high amount of inflammation, and hence it will cause more inflammation. Now, this is how mutations or genetic variations affect the body function. And this is what nutrigenomic testing is involved in doing. Nutrigenomic testing is involved, or it focuses on identifying these mutations or variation. So dietitians, doctors who are required to read nutrigenomic report, they are required to be aware of what are the different names of the genes, what all role these genes have in terms of their body function, what happens if there is a mutation, what happens if there is no mutation, and what will be the effect on human body. Okay, so these are some basic thumb rules in terms of nutrigenomics that all the doctors, dietitians who are practicing nutrigenomics should be aware of. Let me tell you, though it's a science that's interesting, but it is not a science that someone can start following on the go, on the run. One needs to do significant amount of preparation, study, thorough reading, understanding to understand this science and then imply it or apply it in the day-to-day practice. Next slide, please. Next slide. Yeah. So, so let's say, for example, as we are here on the slide, so a normal person and a person, a different person, if let's say I'm carrying 25,000 genes, different genes in my body, there are many proteins that are produced out of 25,000 genes. Some genes are with variation or mutation. Let's assume that I'm suffering from type 2 diabetes. It's possible that some of my diabetes related genes are having mutation. So they are producing some altered proteins, and these altered proteins will have a different function in my body. So my dietitian knows that my inflammation is high, my cholesterol tendency is high, I do not respond well to carbohydrate and rather than fat. That means in order to control my sugar levels in my body, fat needs to be reduced. It's not carbohydrate that's a major culprit, and so on. So understanding this type of information is something that helps. Next slide, please. Next slide. We'll conclude it in the next 5 minutes because we are almost about to. Now, that's fine. Nutrigenomics. Let's also take example of lactose intolerance. I think earlier when I was discussing with some of the team members, I learned that the audience would also be interested in knowing what is nutrigenomics and nutrigenomics and nutrigenetics. So nutrigenomics is a science that helps you understand how food impacts your gene. For example, if I eat some food that triggers inflammation in my body, that impact is nothing but nutrigenomic impact. So inflammation is being triggered. If I eat anti-inflammatory foods, they are going to silence my gene or reduce the inflammation activity. So that's also nutrigenomics. Now, the other term nutrigenetics is where by understanding my genetic makeup, I can identify which protein or which food or which nutrient is required by me. Just to give an example, there are some people who are born with a tendency of having very low circulating vitamin D levels. Their body or body cells do not absorb vitamin D very quickly. So if they are born with genetic makeup where vitamin D absorption is very weak, which means that the vitamin D requirement is very high. This type of understanding is called as nutrigenetics, where based on the genetic makeup, you decide which food, which nutrient is to be given extra, additionally. Your vitamin D is not going to go and trigger changes in the gene, but depending upon my genetic makeup, whether I should consume vitamin D high or low is something that can be decided. So this, dear audience, is nothing but an example of nutrigenetics. So nutrigenomics is when your genetic makeup, or when food or environmental lifestyle has an impact of gene on gene, and it causes further changes in the gene expression. Nutrigenetics is that science where based on gene you decide whether a particular nutrient should be consumed or not. Similarly, we have an example over here that lactose, some people suffer from lactose intolerance. Why? Because lactose per se is a trigger for inflammation in the gut. Now, if lactose is consumed as it causes that. So lactose is typically required to be converted into glucose and galactose. But as you can see over here, that this conversion of lactose to glucose and galactose is carried out by an enzyme called as lactase, and it is produced by a gene called as lactase gene. Now, it has been identified that some people have a mutation in the lactase gene, and it is because of this mutation or genetic variation. It is because of this mutation or genetic variation that lactase gene is not produced at all. Or if it is produced in very less quantity. So what is the result? The result is that because of production of low because of production of low lactase or no lactase, the lactose molecule remains as it is. It is not broken down into glucose and lactose, and hence people will have lactose as it is consumed through milk, and it will cause lactose intolerance. So if I am born with a mutation in my lactase gene, whenever I consume lactose or milk, it will cause a problem to me because I do not have the enzyme lactase to degrade that in my body. So this is how nutrigenomics and nutrigenetics over here will play a role. Next slide, please. One more example, MTHFR. Next slide, please. So this is an example, a typical example of nutrigenetics. Next slide. We'll go to the next slide. We unfortunately have less time. Next slide, please. Next slide. Next. Next. Yeah, that's it. Thank you. Earlier, ma'am. Earlier slide. Slide number 41. That's it. Thank you. So, since we have audience majorly from pharmaceutical background, I think this is good we can discuss. So, we all know about vitamin B9, folic acid. Now, there's a different version of vitamin B9. Folic acid is one version, but the other version is called as folate, or it is also called as L5-methylfolate. So, folic acid is vitamin B9, and the reduced version of folic acid is L5-methylfolate. Now, it happens so that when you consume a vitamin B9 tablet, that vitamin B9 tablet enters in the into the gut, intestine. It is absorbed as a molecule in the liver, and the liver will have to convert folic acid into a form called as methylfolate. I will repeat, as you can see over here on the slide also, that folic acid, once it enters into the liver, it is converted into methylfolate. Now, this activity in the liver is done by an enzyme called as MTHFR, methylene tetrahydrofolate reductase. That's the name of the enzyme, converts folic acid to folate. Now, all those people who have this enzyme active, they will be able to convert folic acid to folate. But unfortunately, the MTHFR enzyme gene, the gene for MTHFR enzyme known as MTHFR gene, in almost 33% people, as per our studies and also as per other studies, it has been seen that there have been mutations in the methylfolate or the MTHFR gene. Now, the moment there is a mutation, whether the mutation is in one copy or both the copies, because every gene is present in two copies, one from father and one from mother. So let's say if you or me, we are carrying mutation in this gene from both the parent, let me tell you, that mutated gene doesn't produce enough MTHFR enzyme. And if the MTHFR enzyme is not produced in enough quantity, let me tell you, the folic acid to folate conversion will not happen in our body, which means that whenever you consume vitamin B9, it is not getting converted into the right form called as methylfolate. And if it is not getting converted into the folate form, it doesn't participate in further reactions which are important for the body. Methylfolate's participation is important in converting homocysteine to methionine. What is homocysteine? A molecule, of course, also an amino acid, but homocysteine is important because higher quantity of homocysteine is known to be a predictor or a causative agent for multiple health concerns, cardiovascular diseases, recurrent pregnancy losses, urticaria, fatigue, foggy vision, many things. So definitely no one would want to have high levels of homocysteine. And what is required to keep homocysteine under control or convert most of the homocysteine in methionine? It is presence of folate. And where do we get folate from? We get folate from conversion of folic acid to folate. Who does that? MTHFR enzyme does that. But if a person is carrying mutation in MTHFR gene, the folic acid to folate conversion does not happen properly. And that's where, dear audience, the person will not be able to get benefit from the vitamin B9 molecule. The person will require to consume methylfolate. So what does this mean? This is a hallmark example of nutrigenetics, where based on whether a mutation is present in the gene or not, I request the coordinator directly to go to 44 slide, where if a person is suffering from mutation, folic acid, okay, as you can see over here, the same cycle over here, you can see that on the second half right hand side, you can see homocysteine to get converted into methionine. If homocysteine is not getting converted into methionine because of presence of 5-methyl tetrahydrofolate, the condition of homocysteinemia occurs, and this homocysteine will be a problem. So next time when you consume a folic acid tablet or a vitamin B9 tablet, please remember, does your body have the right MTHFR gene to convert folic acid to methylfolate? Is your body able to digest that folic acid? These are the questions that we should ask. Or if that conversion is happening well, then do we have the right amount of homocysteine level in our body? We should not have elevated homocysteine. For those individuals who have family history of heart disease, cardiac diseases, those males who are concerned about their cardiac health, it is important that homocysteine as a marker should also be observed. Okay, and hence also those females who have family history of recurrent pregnancy losses or PCOS, for such women it is also important to understand whether homocysteine levels are normal or not, and if they are above normal, then please let me tell you that it is not just vitamin B12 deficiency that's a cause of it, but it is also absence of the right type of B9 form, folic acid or folate form, that will decide whether homocysteine levels are right or not. And hence these days doctors are going a step ahead and they are checking whether a person, if he has a risk of cardiac diseases or the female has a risk of pregnancy losses and so on, they start checking homocysteine levels, which will decide whether which type of product or which type of molecule should be consumed and so on. Right? So this is a classic example of nutrigenetics where the folic acid or folate is not going to go and trigger any gene, but depending upon genetic makeup, it is necessary to understand. It is important to know that the person will benefit not from folic acid but the methyl folate version. And there are pharmaceutical companies now who have understood this and they have now started pitching this importance to the doctors, telling that please check MTHFR genes in your patient with stubborn hyperhomocysteinemia cases. If they have a MTHFR mutation, they should consume methylfolate. If they do not have MTHFR mutation, they should consume the routine folic acid. Right? So this was another example. Next slide, please. So probably this will be a last slide, I think, for the day that we will be discussing. Methylation or impact of right vitamin B9 or B12 is there on many health aspects, be it recurrent pregnancy loss, cardiac arrest, Alzheimer, depression, anxiety. We have seen that, yes, you see a lot of kids these days who are hyperactive, anxious, and so on. And one of the reasons for anxiety is also high homocysteine levels and inappropriate, vitamin B9 and so on. So all this is because of, let's say, not just low hemoglobin, but it could also be because of high homocysteine level. And hence understanding or going to genetic level is also going to be useful to understand which type of food is important, which type of nutrient is important. So quickly to conclude now all this time, what I wanted to mention is that, and nutrigenomics should be looked at as a science to understand genetic makeup of an individual. Nutrigenomics should be looked at as a science to help the doctor and dietitian understand what changes should be made in drug suggestion, diet suggestion, exercise suggestion, and so on. Nutrigenomics is not a blanket tool to predict diseases in people. Nutrigenomic testing to practice requires significant amount of reading, dedication, training. Unfortunately, there are no structured courses in the country which teach nutrigenomics until last year, when we saw that some universities have started training nutrigenomics to their students. Earlier, there were a few, or there was a university that was doing it, but they discontinued. But now we are seeing an increase in number of universities and colleges adapting nutrigenomics as a tool in their routine course and curriculum and practice. And that's how they have started following. So a thorough amount of training, a thorough amount of reading, understanding of this science is important. And definitely, if handled well, this science definitely can be a useful tool in two areas. One, management of lifestyle diseases, and also prediction of certain metabolic imbalances. If handled well, we can save people, or we can help people control the risk of their lifestyle diseases. Right. So that's all from my side today. If you want to ask what is a nutrigenomic test and how it is done, I definitely today was not the time when we wanted to discuss how typically it is done. But let's say there is a process that nutrigenomic test these days can be done by doing a simple blood sample or saliva sample. Then nutrigenomic lab like us will process the test, will generate a report, and then there are diet and doctors and medical experts who can read that report and help people understand how to solve their health issues, etc. I'm glad that we are also doing a research project in which is funded by Ministry of Ayush. I'm happy to mention that I'm one of the investigators on it. It's one of the first of its kind in the world, where we are trying to check that how yoga has an impact on gene expression. So we are about to conclude that research project in the month of December. We will conclude that research project. We had identified pre-diabetic patients, and pre-diabetic patient, a group of it received yoga therapy, the other control group didn't, and we are checking whether there was any change in at gene expression level that yoga does. Similarly, diet also does, and so on. And there are many such studies that subsequently will follow. So that's all from my side. Thank you very much for being a very wonderful audience and patient audience. My sincere apologies for the technical glitches in the beginning of the presentation, and I'll be happy to answer if there any queries. Though I'm sorry I had to truncate my presentation due to lack of time over here. Thanks once again to the organizers, and happy to answer the questions.
Thank you so much, sir, for your such an informative session. Dear participant, the session is open for discussion. Please unmute yourself and ask your question to the speaker, or you can place your question in the chat box.
Hello, good afternoon, sir.
Hello.
Yes, sir, please continue.
Hello. Hello, good afternoon, sir.
Good afternoon.
Thank you, sir. It was overall nice presentation, and it was very interesting to listen to you, sir. Actually, my question is, sir, is there any method to assess the diet intolerance?
Which intolerance?
Diet intolerance, because the diet contains the different kind of substances or the substrates. So, is there any method to assess the diet intolerance?
Yes, so diet comprises of several things, but there are few foods or materials that have been known to be connected with genetics, makeup, and intolerances. Gluten is one. The other is lactose. Gluten is present in wheat. Lactose is present in milk. Then there are certain sensitivities such as caffeine, salt. So all these gluten, lactose, caffeine, salt, these are some of the foods or nutrients to which there has been a genetic association mapped. So with the help of genetic testing, we can study association of this. Not all foods we have correlation with genetic makeup. So we'll not be able to judge that. But the other foods such as carbohydrate or fat, how much a person should consume, how much he should not consume, etc. This type of advice can also be done. Yes, there is advice possible, but not for all foods, some foods.
Yes. But the gene is, sir, we are talking about the molecular biology and the molecules, that is gene. So it is very complicated phenomena. So a person in a normal lifestyle, how he can find out his normal genetic makeup by observing his daily lifestyle?
It's very difficult to observe genetic makeup. So genetic analysis will always have to be done by testing a gene. So one will have to undergo a nutrigenomic test by taking a saliva sample or a blood sample and so on. The test has to be carried out, and then once the report is generated, the test results have to be discussed. So a person cannot observe, but what I will suggest is all those people whom you come across, where you feel that okay, a person is suffering from stubborn lifestyle disease, be it obesity or PCOD or cholesterol or sugar imbalance, high sugar levels, and so on. So whenever you observe people with such metabolic imbalances, such people can talk to nutrigenomic experts. Such people can identify whether nutrigenomic test can be done or not. And then there are counselors who can guide on that.
Okay, sir. Thank you.
Good afternoon, sir. This is Dr. Nitya from American College. It's a very wonderful presentation, sir. I have one doubt that in Nutrigenomics test analysis, you have listed some few genes, no, sir, like 10 to 14 genes. But usually, if we look into the literature, many genes are there and they are studied and linked to a particular disease. For example, even you know very well that metabolic pathways are very complicated and many genes are involved. Even in a gene, many SNPs are there. How we can fix certain genes for the genetic analysis to be confirmed that if we do these genes alone, we can come to conclusion and we can go for advice to the particular individual.
Okay, so that's a very important question, Dr. Nitya. Thanks for your comments and compliments. First of all, for analyzing a particular condition, limited genes cannot be used. We need to look at multiple genes. Okay, that is one thing. The number of genes that we check for a particular condition, let's say, for example, the number of genes for gluten intolerance, number of genes for obesity, number of genes for diabetes, they are varied, they are different. Typically, the number may vary from one gene or one SNP up to hundreds of genes and SNP.
Yes, sir.
Depending upon the condition, the number of associated genes are checked. Okay. So, what organizations like us do when they have to use nutrigenomics for practice, we have to generate different test panels. For example, our weight loss test panel that we have developed, we look at somewhere around 60 genes and corresponding 80 SNPs in it.
Yes, sir. Yes.
All of them which are associated with weight loss. So once we go through all these factors, then we are able to make a choice on which gene, what is the information present in all these genes, how to correlate it with diet, exercise, and lifestyle. And let me also mention that as the research in nutrigenomics goes on increasing, the number of genes also will go on getting added. So it will become more of a multi-etiological and a polygenic study, which will strengthen the analysis of nutrigenomics.
Yes, sir. So one more question, sir. And also in gene analysis, it varies according to the geographic conditions. If you study South Indians and rather North Indians, even the SNP is varied. So we have to fix the genetic analysis as per that geographic conditions, sir.
Correct. So that's also a very important question, that since people come through different ethnicities and different background, how will genetic or nutrigenomic change from geography to geography? Uh, the good news over here is that all genes have a very absolute function. Okay.
Yes. Yes,
so irrespective of whichever region the gene is present in, the intervention depends on the variation the gene carries. I'll give an example. Suppose I have caffeine sensitivity because of genetic makeup, which means that my genetic makeup in caffeine is such that I should not typically be consuming more than 3 cups of coffee a day.
Yes, sir. Yes, sir.
Okay. Now, if I have mutation, I should not consume more than 3 cups. Now, in India, when you study, let's say, caffeine genetics of 100 people, and you find that there are 20 people who have caffeine sensitivity genes and 80 who do not have caffeine sensitivity. The intervention is that those who are sensitive should not consume more than 3 cups. Those who have no sensitivities, no problem, they can consume up to 5 cups.
Yes.
What does that mean? It means that the impact of gene is absolute, irrespective of the state.
Okay, sir.
Okay.
Okay,
now, if in these 20 people, whether all of the 20 are from Chennai, or they are from Delhi, or they are from Kolkata or Mumbai, it is a epidemiological study that will tell us that what is the prevalence of that sensitivity. But that doesn't change the intervention. Okay. So yes, that's definitely there. Prevalence is there, but prevalence studies will help when without doing the test, you want to directly apply the intervention.
Yes, sir. Yes, sir. Thank you, sir. Thank you so much, sir. Thank you.
My pleasure.
Anyone else from the participant?
Hello, sir.
Thank you. Yes, sir.
Oh,
Hello.
yes. Yeah.
Just yes, sir. Yes. Just madam has asked one question to you regarding the geographical location. So the same question of mine is that the persons from the two different countries having the different genetic expression and also having the different diet habits. Is there any influence of this diet on the gene expression?
Yes, definitely there is a impact of diet on gene expression. For example, okay, if in northern India a lot of gluten is being consumed, in southern India less gluten is being consumed. So definitely, if Indian population has a lot of gluten sensitivity, we should assume that a lot of inflammatory responses will be seen in the northern population who are consuming more amount of gluten. That's something that can be anticipated. Unfortunately, we do not have studies which are validating these observations or thoughts of ours. Okay, so gene expression profiles may vary depending upon the diet, but at the same time still people in the northern India are consuming large amount of gluten, or they continue to do that probably because they are also consuming a large amount of probiotic in form of curds, which is sort of balancing their inflammation. And hence they have not come to the northern Indian population has not come to a conclusion that okay abhi गेहूं नहीं खाएंगे because it has been creating a lot of problem. So yes, epigenetic changes or gene expression changes may vary from region to region, but such patterns are useful when you have to make a general conclusion of a particular region. Okay, definitely that. Nutrigenomic approach is more used at individual level so that that information can be used for that individual. Okay, so I hope I've answered your question, both the fronts.
Yes, sir. Yes, sir. So I think what I'm thinking is, sir, the gene expression is mostly dependent on the kind of background that we are having since the childhood. So the childhood
Yes,
and
yes,
the genes that we are carrying. Am I right, sir?
absolutely,
So
absolutely. Gene expression,
because the kind
absolutely.
of
Gene
the food habits
expression.
in the childhood, what we are taking since the childhood. So accordingly, the gene is getting expressing in our body because it is adapting the different conditions and different surroundings as per the geographical location will also influence the gene expression, isn't it, sir?
Indeed, indeed it will. It will. Indeed it will. So, for example, I may be, let's say, I may be born with a genetic makeup where I have a very high tendency of inflammation, and I would have seen, let's say, for example, all the impacts of high inflammation. But knowingly or unknowingly, since childhood, I've been eating a lot of fruits or colored fruits and vegetables, which have added a good amount of anti-inflammatory nutrients to my body. So, in spite of having high inflammation genes, I've been consuming a good amount of anti-inflammatory diet also, and hence I've not seen impact of inflammation in my body all these years. So yes, it's definitely going to impact. Knowingly or unknowingly, has impact.
Yes, sir. Yes, sir. Thank you, sir. Thank you very much.
My pleasure.
Thank you so much, sir, for your wonderful session. Now, I would like to request Miss Yasmin ma'am to sum up the session. Over to you, ma'am.
Thank you very much, ma'am. Thank you very much. Good afternoon.
Dear
Uh,
participant, please mute yourself. The session is going to end. Please.
Yes, thank you very much, ma'am. Good afternoon. I am here to sum up this session. It was nice and thorough presentation given by sir. Sir has explained very well the genes and environment, how it triggers the lifestyle diseases like obesity, hypertension, diabetes, cancer, and he explained the need of nutrigenomics for managing all those diseases. Sir explained the disease management by balancing the lifestyle diet and exercise. He also explained the significance of nutrigenomics in cardiac health management. Sir has focused on fundamentals of nutrigenomics and genetic variation impact, and Sir also explained us about the relation of gene variations with metabolic diseases by presenting various examples and the case studies thoroughly. Thank you very much, sir, for sharing your knowledge. It's over to you, ma'am.
Thank you so much, ma'am. On behalf of Bharati Vidyapeeth College of Pharmacy, I express my sincere thanks towards you, sir. Thanks for sharing your valuable time and your guidance. And we are hoping your guidance in the coming days also. Thank you so much, sir.
Thank you
Dear
so much, ma'am. It was
participants,
wonderful interacting with you. Once
thank
again,
you.
thanks to the organizers and participants.
Dear participant, please turn on your cameras so that we'll have a photo with sir. Thank you so much, sir. Thank you, everyone.